Hello everyone, my name is Jaspreet Kaur. I am an assistant professor in School of Health Sciences in RIMT University. Today we will discuss depression. First of all, introduction. Depression is classified as a mood disorder. It may be described as feeling of sadness, loss or anger that interfere with a person's everyday activities. It is also fairly common. The Centers for Disease Control and Prevention trusted source estimates that 8.1% of American adults ages between 20 and over had depression in any given 2-week period from 2013 to 2016. People experience depression in different ways. It may interfere with your daily work, resulting in lost time and lower productivity. It can also influence relationships and some chronic health conditions. Major life events such as bereavement or the loss of job can lead to trusted sources depression. However, doctors only consider feeling of grief to be part of depression if they persist. Depression is an ongoing problem, not a passing one. It consists of episodes during which the symptom lasts for at least 2 weeks. Depression can last for several weeks, months, or years. Depression is a common illness worldwide, with an estimated 3.8% of the population affected, including 5% among adults and 5.7% among adults older than 60 years. Approximately 280 million people in the world have depression. Depression is different from usual mood fluctuations and short-lived emotions responses to challenges in everyday life, especially when recurrent and with moderate and severe intensity. Depression may become a serious health condition. It can cause the affected person to suffer greatly and function poorly at work, at school, and in the family. At its worst, depression can lead to suicide. Over 7 lakh people die due to suicide every day. Suicide is the fourth leading cause of the death in 15 to 29 years olds. Next is the causes of depression. There are several possible causes of depression. They can range from biological to circumstantial, and common causes include, first of all, family history. You are at a higher risk for developing depression if you have a family history of a depression or another mood disorder. Second, early childhood trauma. Some events affect the way your body reacts to fear and stressful situations during childhood. Next is brain structure. There is greater risk for depression if the frontal lobe of your brain is less active. However, scientists do not know if this happens before or after the onset of depressive symptoms. Next is the medical conditions. Certain conditions may put you at higher risk, such as chronic illness, insomnia, chronic pain, or attention deficit hyperactivity disorder. Next cause is drug use. A history of drug or alcohol misuse can affect your risk of depression. About 21% of people who have a substance use problem also experience depression. In addition to these causes, other risk factors for depression include low self-esteem or being self-critical, personal history of mental illness, certain medications, stressful events such as loss of loved one, economical problems, and a divorce. Many factors can influence feeling of depression as well as who develops the condition and who doesn't. Next moves to depression symptoms. Depression can be more than a constant state of sadness or feeling blue. Major depression can cause a variety of symptoms. Some affect your mood and others affect your body. Symptoms may be ongoing or come and go. The symptoms of depression can be experienced differently among men, women, and children differently. So first of all, men may experience symptoms related to their first of all mood such as anger, aggressiveness, irritability, anxiousness, and restlessness. Emotional well-being such as feeling empty, sad, and hopeless. Behavior such as loss of interest, no longer finding pleasure in favorite activities, feeling tired easily, thoughts of suicide, drinking excessively, using drugs, engaging in high risk activities. Sexual interest in male, such as reduced sexual desire, lack of sexual performance. Cognitive abilities, such as inability to concentrate, difficulty completing tasks, delayed responses during conversations. In male, sleeping patterns such as insomnia, restless sleep, excessive sleepiness, not sleeping through the night. Physical well-being of the males include such as fatigue, pains, headache and digestive problems. Women may experience symptoms related to their mood such as irritability, related to their emotional well-being such as feeling sad or empty, anxious or hopelessness, behavior such as loss of interest in activities, withdrawing from social engagements and thoughts of suicide. Symptoms related to their cognitive abilities such as thinking or talking more slowly. Sleeping pattern such as difficulty sleeping throughout the night, early wake up and sleeping too much. Physical well-being such as decreased energy, greater fatigue, changes in appetite, weight changes, aches, pain, headache and increased cramps. Children may experience symptoms related to their mood such as irritability, anger, mood swings, crying. Emotional well-being such as feeling of incompetence, example I can't do anything right, or despair, crying, intense sadness. Behavior of children includes such as getting into trouble at school or refusing to go to school, avoiding friends or siblings, thoughts of death or suicide. Cognitive abilities such as difficulty concentrating, decline in school performance and there will be changes in grades. Their sleeping patterns such as difficulty sleeping or sleeping too much. Physical well-being such as loss of energy, digestive problems, changes in appetite, weight loss or weight gain. Now how depression will be diagnosed? There isn't single test to diagnose depression, but your healthcare provider can make a diagnosis based on your symptoms and a psychological evaluation. In most cases, they will ask a series of questions about your moods, appetite, your sleeping pattern, activity level and your thinking level, so about your thoughts. Because depression can be linked to other health problems, your healthcare provider may also conduct a physical examination and other blood work. Sometimes thyroid problems and a vitamin D deficiency can trigger the symptoms of depression. Don't ignore symptoms of depression. If your mood doesn't improve or gets worse, seek medical help. Depression is a serious mental health illness with potential for complications. If left untreated, complications can include weight gain or weight loss, physical pain, substance use problem, panic attacks, relationship problems, social isolation, thought of suicide and self-harm. Next, move to the types of depression. Depression can be broken into categories depending upon the severity of the symptoms. Some people experience mild and temporary episodes while others experience severe and ongoing depressive episodes. There are two main types, major depressive disorder and the second one is persistent depressive disorder. Now we will discuss one by one. First of all, major depressive disorder. It includes, this is the more severe form of depression, that's why this is known as major depressive disorder. It's characterized by persistent feeling of sadness, hopelessness and worthlessness that do not go away on their own. In order to be diagnosed with clinical depression, you must experience 5 or more of the following symptoms over a week, 2-week period. And the symptoms include feeling depressed most of the day, loss of interest in most regular activities, significant weight loss or weight gain, sleeping a lot or not being able to sleep, slow thinking or movement, fatigue or low energy most days, feeling of worthlessness or guilt, loss of concentration and indecisiveness, recurring thoughts of death or suicide. There are different subtypes of major depressive disorder which the American Psychiatric Association refer to as specifiers. These include atypical features, anxious distress, mixed features, peripartum onset during pregnancy and right over giving birth, seasonal patterns, melancholic features, psychotic features and catatonia. Next is the second type of depression disorder is persistent depressive disorder. This used to be called dysthymia. It is a milder but chronic form of depression. In order for the diagnosis to be made, symptoms must last for at least 2 years. Persistent depressive disorder can affect your life more than the major depressive disorder because it lasts for a long period. And the symptoms include, it's common for people lose interest in normal daily activities, feel hopeless, lack productivity, have low self-esteem. Now, how is depression treated? Living with depression can be difficult, but treatment can help improve your quality of life. Talk to your healthcare provider about possible options. The Helpline Find Care tool can provide options in your area if you don't already have a doctor. You may successfully manage symptoms with one form of treatment, and you may find that a combination of treatments works best. It's common to combine medical treatments and lifestyle therapies, including the following. First of all, medications. Your healthcare provider may prescribe antidepressants. There are different types of antidepressants like selective serotonin reuptake inhibitors, monooxidase inhibitors, tricyclic antidepressants. So, there are different types of antidepressants. Next is anti-anxiety drugs. Next is antipsychotic medications like haloperidol or risperidol. Each type of medication that's used to treat depression has benefits and potential risk. Along with medications, some therapies are also necessary to treat the patient. First of all, psychotherapy. Speaking with a therapist can help you learn skills to cope with negative feelings. You may also benefit from family or group therapy sessions. Next is light therapy. Exposure to doses of white light can help regulate your mood and improve symptoms of depression. Light therapy is commonly used in seasonal affective disorder, which is now called major depressive disorder with seasonal pattern. Rehabilitation, which focuses on social skills and job training to help people with schizophrenia and depression function in the community and live as independently as possible. Cognitive remediation, which involves learning techniques to make up for problems with information processing. It often uses drills, coaching, and computer-based exercises to strengthen mental skills that involve attention, memory, planning, and organization. Individual psychotherapy. This will help the person better understand their illness and learn coping and problem-solving skills in major depressive disorder. Family therapy, which can help families deal with a loved one who has schizophrenia and depression, enabling them to better help their loved ones. Group therapy and support groups, which can provide continued mutual support. Now, the lifestyle changes to treat depression. First of all, exercise. Regular exercise can be as effective at treating depression as medication. Not only does exercise boost serotonin, endorphins, and other feel-good brain chemicals, it triggers the growth of new brain cells and connections, just like antidepressants do. Best of all, you don't have to train for a marathon in order to reap the benefits. Even a half-hour daily walk can make a big difference. For maximum results, aim for 30 to 60 minutes of aerobic activity on most days. Next is social support. Strong social networks reduce isolation, a key risk factor for depression. Keep in regular contact with your friends and family, or consider joining a class or group. Volunteering is a wonderful way to get social support and help others while also helping yourself. Next is nutrition. Eating well is important for both your physical and mental health. Eating small, well-balanced meal throughout the day will help you keep your energy up and minimize mood swings. While you may be drawn to sugary foods for the quick boost they provide, complex carbohydrates are a better choice. They will get you going without all too soon sugar crash. Next is sleep. Sleep has a strong effect on mood. When you don't get enough sleep, your depression symptoms will be worse. Sleep deprivation exacerbates irritability, moodiness, sadness, and fatigue. Make sure you are getting enough sleep each night. Very few people do well on less than 7 hours a night. Aim for somewhere between 7 to 9 hours each night. Stress reduction. Make changes in your life to help manage and reduce stress. Too much stress exacerbates depression and puts you at risk for future depression. Take the aspect of your life that stress you out, such as workload or unsupportive relationships, and find ways to minimize their impact. Can depression be prevented? Depression isn't generally considered to be preventable. It is hard to recognize what causes it, which means preventing it is more difficult. But once you have experienced a depressive episode, you may be better prepared to prevent a future episode of depression by learning which lifestyle changes and treatments are helpful. Techniques that may help include regular exercises, getting plenty of sleep, maintaining treatment, reducing stress, building strong relationship with others. Other techniques and ideas may also help you prevent depression. This is all about the depression. To conclude the today's topic, we have discussed about the depression. Depression is a two types like major depressive disorder and persistent depressive disorder. Major depressive is the most common. If symptoms are persist for a longer time, then we can say it is dysthymia or persistent depressive disorder. Most common symptoms include helplessness, hopelessness, and sleeplessness and worthlessness. Apart from this, person also feeling of sadness, moodiness, irritability, anger. It depends upon the males and females and children's different symptoms experiencing by the males, females and children. Treatment include antidepressants medications. Along with antidepressants, anti-anxiety and antipsychotic medicines are also given if the psychotic symptoms are present. Not only medications work to treat the depression, along with the medications there are some therapies and some lifestyle changes are required to improve the lifestyle of the depressive patients. That include regular exercise, good nutritious diet, enough sleep, which is important for the improvement in daily life. This is all about the depression. Thank you.